Good morning, everyone, and welcome to Module 5. This week, we're focused on the topic of endocrinology and dealing with the endocrine system. So for this week, in order to prepare for the lab, here are the procedures that you will need to review in your MindTap Cengage book. The first one does not have any sort of connection, but it is something we've been doing for quite a few weeks now. So performing that quality control measure for the glucometer. And then chapter 45-4, looking at how to perform a blood glucose, and procedure 43-5, learning how to review lab results. So I'm going to take this time just to go over some of the endocrine system, some of the functions and the specific glands, and then talk about kind of what your role in endocrinology is. So let's get started. Endocrinology is looking at the endocrine system. This is an elaborate network of glands that communicate within the body to secrete hormones for the purpose of maintaining homeostasis. The primary gland of this system is the pituitary, penile, thyroid, thymus, parathyroid, pancreas, adrenal, and ovaries in the female, and the testes in the male. So knowing the different parts of the endocrine system and the different glands that are part of it, what we really need to discuss is some of the functions of the endocrine system. The vital function of the endocrine system is to produce and regulate the hormones of the body. The chemical transmitters that regulate different body functions include dealing with growth, development, mood, tissue function, metabolism, and sexual functions for both males and females. Now, with the endocrine system, your nervous system works very closely, but not only with the endocrine system, but also the exocrine system. And all of those are kept in line to help maintain homeostasis. Our bodies are equipped to respond to both internal and external stimuli. So when the nervous system perceives something as harmful, the body responds by creating a negative feedback loop. This means that the body acts to reverse the direction of change to regain or maintain homeostasis. Other actions that our bodies make takes place in response to a stimuli, and that is considered a positive feedback loop. This will encourage the stimuli to continue or even accelerate, which will help to maintain homeostasis. So we understand the functions somewhat, we understand what's part of it. Let's look at each of the specific glands of the endocrine and exocrine system to really understand their purpose. We're going to start with talking about the hypothalamus. This is situated inside the center of the brain below the thalamus, hence hypothalamus. It is similar in size and shape to that of an almond. It is the connection between the endocrine and the nervous system, and the main function of the hypothalamus is to start and stop the production and the release of hormones throughout the body. The hypothalamus will produce two specific hormones: the antidiuretic hormone, or ADH, which is responsible for increasing water absorption, and oxytocin, which is responsible and plays a role in childbirth. Next, we have the pituitary gland. This is located near the base of the brain in the subula tecturna. It's a small depression of the siphoned bone. This gland is considered to be your master gland due to the fact that it regulates all other exocrine and endocrine glands. Next, we have the penile gland. This is located in the posterior end of the corpus callosum in the brain, and it secretes melatonin. Now, melatonin is responsible and released at night to help regulate the circadian rhythm, which helps with your sleep cycle. Your thyroid gland is responsible for the body's metabolism. It's located anterior to the trachea, just below the thyroid cartilage, and it is shaped like a butterfly. The thyroid gland is responsible for secreting three hormones: thyroxine, or T4, trioxythyroid, which is T3, and calcitonin. Your parathyroid gland is considered to be both an endocrine and exocrine gland. The exocrine function is in the secretion of gastric juices to the small intestine via a viaduct system, and the endocrine gland function resides within the islets of Langerhans, which is a small cluster of cells in the pancreas. My goodness, we're talking about the pancreas. I'm very sorry, I skipped right over the parathyroid gland. So the pancreas is considered both exocrine and endocrine, and the endocrine function is that it resides within the islet of Langerhans, which is a small cluster of cells within the pancreas that secrete hormones directly into the bloodstream. Your parathyroid gland are the 4 of the glands that are located within the posterior surface of your thyroid. Each of these small glands is about the size and shape of a grain of rice, or 3 to 5 millimeters in diameter. They secrete the parathyroid hormone, or PTH, which is responsible for the amount of calcium that is stored in bones and the amount of calcium that is circulating throughout the bloodstream. Adrenal glands are next. They are located on top of each kidney, and they are triangular glands consisting of an outer portion and an inner portion. These portions serve different functions for the hormone production. The outer portion secretes hormones called glycocorticoids, mineralocorticoids, and androgens, all of which are essential for life. The inner portion synthesizes and secretes, as well as stores, calcitonin, which are released into the bloodstream when someone is experiencing physical or emotional stress. Ovaries are the primary reproductive organ of the female reproductive system. We did talk about those back in your previous quarter, so I am not going to go into them again. Same thing with the testes. We did talk about those during nephrology the previous quarter, so I'm going to skip right on over those. We are going to talk about the placenta. That is a spongy structure that joins the mother and the fetus together and provides a blood supply between the two. This is only present during pregnancy and acts as an endocrine gland by producing estrogen, progesterone, and the HCG hormone. And finally, we have our gastrointestinal mucosa and the thymus. Your gastrointestinal mucosa is the lining of the stomach and small intestine that contains endocrine glands that produce specific hormones that facilitate digestion. The thymus gland is composed of lymphatic tissue and is located in the mediastinal cavity in the front of and above the heart. The thymus is part of the lymphatic system, but also functions as an endocrine gland by releasing thymosin and thymopoietin. So now that we have discussed pretty much all of the glands and what their functions are and what they reproduce, we need to talk about how you assist in medical specialties like endocrinology. So endocrinology is the study of those endocrine systems, and there are 2 types of glands that we focus on, exocrine and endocrine. Exocrine will carry and secrete hormones into ducts, where endocrine glands secrete hormones directly into the bloodstream. You'll work with an endocrinologist who is a specialized provider in the diagnostic, treatment, and management of diseases with both endocrine and exocrine glands. Your role will be much like any other. You'll room patients, obtain vital signs, get medical histories, complete endocrine-related questionnaires, perform venipunctures, but then you'll also do glucose monitoring and education for proper use of a glucose monitor, provide education and support based upon treatment protocols established by the physician, and assist with maintaining accurate medication records. Now, you might have to deal with things like thyroid conditions and diabetes mellitus, or DM. And I'm going to let you guys learn a little bit about both of those on your own. If you do have any questions, please make sure that you do bring them to class. Along with this, we have to learn how to work with medical emergencies, specifically those related to the endocrine system, and handling, for example, diabetic emergencies. This could either be hypoglycemia or hyperglycemia. Both conditions may cause a rapid onset of altered mental levels of consciousness. The greater risk to patients is hypoglycemia. When the blood sugar falls below 70 milligrams per deciliter, that is what we consider hypoglycemia. This may be a result of a skipped meal, vomiting after taking medicines, excessive exercise, or some unknown reason. The patient may appear intoxicated, have cold or clammy skin, and be anxious or combative. If the person is experiencing hypoglycemia, they are in grave danger when their blood sugar drops below 40 milligrams per deciliter, because the brain requires that much glucose to survive. If there is any doubt whether the patient is hyper or hypoglycemic, glucose may be admitted. This could be a paste, a tablet, or some sort of drink with orange juice with added sugar. If they are unconscious, you can do IV glucose. Regardless of their state, always keep the patient warm and comfortable. And the last thing I want to take just a few minutes and talk on is the topic of hematology along with endocrinology. We want to focus specifically on diabetic testing. So diabetes is evaluated and managed through blood testing. Diabetics monitor their blood sugars with a portable machine called a glucometer, like we've been working with in class. The physician will often order what we call a hemoglobin A1C to test the long-term control of diabetes. This test will look at the patient's average plasma concentration of glucose over a 3-month period. And typically the results for a non-diabetic patient are somewhere between 3.5 to 6%. The physician may also order a glucose tolerance test or a GTT. Blood will be drawn to detect a baseline after eating, and then the patient will be given oral carbohydrates to drink. Then we'll redraw every 30 minutes after 1 hour, therefore, and up to 5 hours according to the physician's orders. Now, along with hematology and talking about the blood testing and handling diabetic emergencies, the other thing we focus on with endocrinology glands, specifically that of diabetes, is nutrition. And we're going to talk about the diabetic diet. So as a medical assistant, you need to explain to a patient that one day you may need to do this, and we have to talk about a diabetic diet. A diabetic diet is a therapeutic diet designed for diabetic patients and considers several factors, including the type of insulin therapy that the patient does receive, the severity of their diabetes, their activity level as well as their exercise level, ability for activity, and the calories that they need in order to maintain a healthy weight. So that is going to wrap up the chapter on endocrinology. Please make sure that you do review those procedures in your book so that way you are ready for class this week. We will try to make sure that we are dealing with those as best as we can. I know that you guys have already been doing some glucose logs, so it's not too unknown, but we're also going to use this day to really kind of hone in on some of our other skills that we might have been neglecting for a couple of weeks now. So if you do have any questions, please make sure that you are bringing them to the lab class. Otherwise, I look forward to seeing all of you bright and early on Tuesday morning. Have a great week, guys. Bye-bye.